CANWin is the state-of-the-art PC Windows-based cardiac autonomic neuropathy analysis system. What we are seeing here is the machine with the control panel, which is seen on the left-hand side. It analyzes both the sympathetic and the parasympathetic autonomic nervous system response of the patient. The system uses tachocardiogram and automatic non-invasive blood pressure measurement to conduct a battery of 6 tests. Being fully automatic, CANWin eliminates the need of manual recordings, readings and calculations. Since these tests require patient cooperation, a unique patient prompt panel is provided which helps the patient intuitively. Inbuilt time domain waveform analysis and BP measurements make the task of conducting all 6 CAN tests very easy. This CANWin machine and the software has been made in collaboration with the Genesis Medical Systems and MV Baptist Specialty Center. In this we can see the 4 tests which test for the parasympathetic and 2 which test for the sympathetic. To go into details of the parasympathetic system, the resting heart rate is first evaluated. Following this, the heart rate response to deep breathing. Following this, we go heart rate response to standing and the heart rate response to Valsalva maneuver. In the sympathetic test, we analyze the BP response to standing and the BP response to sustained hand grip. These red markings or legends indicate that the test is not conducted. Finally, when each of these tests is performed, at the end the green lights on. Sir, now you have to relax yourself. Now we are going to take the first test for the day, and this is the resting heart rate. Be as relaxed as possible. Now this is the resting heart rate being obtained from the patient after connecting the ECG leads. Now we wait for the consistent rhythm and then we see. Once it is consistent, then we click on the record button. Yes, now we have pressed the recording button and the recording goes on. When it is complete, the entire beam becomes violet. That says, or that indicates the entire recording is over. The resting heart rate is recorded for the entire 1 minute. And this is the report of the resting heart rate. And this is the variations in the heart rate which is depicted here. The resting heart rate is 73 per minute for this patient. Now we will go on to the second test, which will analyze the heart rate response to deep breathing. Sir, your first test is over. Now we will go on to the second one, which will be testing your heart rate response to deep breathing. You have to carefully follow the instruction, and if you see in the prompt panel here, you will get a display of a red and a green color. When the red color comes, you have to take in a deep breath and hold it. When the green color comes, you have to leave the breath. Okay? Okay. Now we will perform the test. Be relaxed. Now the red light is on. Now the patient will take in a deep breath and hold it. Now the green light is on. Now the patient will leave his breath. And this shows the variation for deep breathing. This is repeated 4 to 5 times. Once the second test is over, this immediately gives us the results of the deep breathing. You get the average deep breathing difference, coefficient of variation, then you get the respiratory sinus arrhythmia index or the RSA index, and the expiration to inspiration ratio. For this patient, it is normal. So now your second test is over. Now we'll go on to the third one, which will be the heart rate response to standing. Initially you will get a green light, which will be there for a minute. During that period of time, you have to relax as much as possible. And when the red light is on, you have to slowly stand up on yourself on the sheet of towel which is placed here. Okay? Yeah. Now you can see the green light is on the prompt panel and the patient is lying down comfortably. For the next 1 minute, he will be relaxed and his ECG leads will be recording simultaneously. This recording goes on for the entire 1 minute, after which you will see that the switch off to the red light and then the patient will stand. This recording for ECG goes on for the entire 1 minute, and now once the entire recording is complete, the test is aborted. Again, here you can see the average RR interval is obtained, the coefficient of variation is obtained, and 30:15 ratio is also obtained, and the test result is normal. So now we will be going to the fourth test, which is the Valsalva maneuver. It is nothing but when the green light is on, you have to blow into this tube. And you see here, this is a panel here.
Okay, yes, sir.
And here you should maintain it at 40.
Okay, sir.
Okay. When the red light comes off, you can relax. Okay. Now we'll perform the test. Just be ready. Now the red light is on, and the patient blows through the tube, maintaining it at around 40. Now he is asked to take away the tube from his mouth. Now this is a display of the entire report during the Valsalva maneuver, and again you can see the average RR interval, the coefficient of variation, and the Valsalva ratio appearing to be within normal limits. So now we have got two more tests to do, and now we have attached a BP cuff to your right arm, which will inflate and deflate automatically. So there will be some tightening of your arm. Okay. So now we'll be testing. The first will be on the blood pressure response to standing. Okay. When the green light is on, you have to lie down, and when the red light is on, you have to stand up. Then automatically a BP gets recorded. Okay. His supine BP was 125 systolic and 79 diastolic. Now his BP measurement is on progress while the patient is standing. There will be one immediate measurement of the BP of the systolic and diastolic, and after 60 seconds there is one more measurement which will be taken. His immediate BP on standing is 139 systolic and 97 diastolic. His systolic and diastolic BP after 60 seconds of standing is 131 and 93, and it automatically calculates the fallen systolic BP, which is -6 millimeters mercury, which is within normal limits. So now this is the last test which you're going to do. I'm doing it for you. This is a sustained hand grip. All that you have to do is maintain a constant pressure and keep it sustained for the entire course of your test. Now how do you know the entire course of the test? Is initially there will be a green light which will be displayed. At that point of time it says that you get ready, at the same time be relaxed. When the red light comes, you have to maintain a sustained pressure. And the sustained pressure, if you see, there will be some numbers displayed in this hand grip indicator. You have to maintain it above 300. Okay. Now the patient is already maintaining a sustained hand grip, and it has already gone for 31 seconds. In the meantime, when he was not holding on to the instrument, his systolic and the diastolic BP was 128/85. Now you can see this is a hand grip indicator which shows you a value of 487 to 490. Now the sustained hand grip test is completed. Now you can see that there is an increase in diastolic blood pressure of 15 mmHg, that is within normal limits. Now the 4 tests in parasympathetic and the 2 tests in the sympathetic are over, that is indicated by the green light. Now we shall go to the result. This finally gives us the entire result of the patient, and the entire test appears to be within normal limits.